I just want to tell you, 1950, our medical knowledge doubled every 50 years. Today, every 2 months, medical knowledge doubles, partly because of AI incorporation. ChatGPT went for the medical exam, and 90% of the scores it scored. It's unbelievable. Now, medication, the patient is on 10 different medication. We are starting a new medication. No way in a short time we can refer and interactions and everything. Now, AI is telling us, hey, this interfering with this one reduces dose. It is unreal. Workflow management is also fantastic. CRISPR technology, we are able to know all the, so there are some genetic disorders like hemophilia, cystic fibrosis, and variety of different things. And that is because of the genomes or RNAs and DNAs. You know what is the DNA, right? DNA are a series of sequence of amino acids in a proper way. If some of them are deranged, so they get a genetic disorder and they cannot function. Guess what? Now we are able to identify exactly where it is defective, which part of it is defective, and we can send messages from outside with a computer, go and identify the defective part of the gene and cut the gene, get that out of the way, and put a new area which is supposed to be that way. Thereby, we are able to treat the genetic disorders. Isn't it wonderful? Come on, give a clap for this technology. Awesome. It's also helping the drug discovery pipeline. CRISPR technology controls the cell function from outside. Precise DNA alterations, cell communication from outside, from computer to go to the cells and communicates. Gene defects, repairs the defects, and muscular dystrophy and cystic fibrosis, how we can be treated. Now, nanomedicine, nanoparticles, you guys don't know, it's very, very, very tiny particles. We are utilizing the tiny particles to attach a drug, and that we are telling the tiny particle to go and identify the tumor cells, cancer cells, and deliver that medicine to the cancer cells. Okay? So, we don't have to have systemic side effects. Do you remember chemotherapy when we give, you get ulcers, diarrhea, and all those things. Now we are eliminating everything. We are targeting the cancer cells and cancer cells only. And also, the cancer cells, whenever there is a cancer tumor, you know how many cells do we have in our body? 30 trillion cells. 30 trillion cells we have in our body. And each cell is dividing in a certain way. But unfortunately, some of the cells go astray. Instead of dividing every 3 months, it starts dividing every 30 seconds. And that's the reason why it multiplies, it becomes cancer. Okay? So, but the cancer is nourished by blood vessels. A lot of cancer cells invite a lot of blood vessels, and so it can nourish rapidly, it can grow. But nanotechnology cuts off the blood supply for causing blood clots, and thereby the tumor is destroyed. Isn't it fantastic? Robot in our office, it is standing in the front. When the patient comes and talks to the robot, it asks the same questions the bankers will ask. What is your date of birth? What is your last 4 digits of a social security number? What is your zip number? And recognizes and sends the patient in. Takes the patient in, takes the blood pressure, and goes to the doctor. When the doctor comes in, it takes notes for the doctor. They don't have to sit down and type. Isn't it amazing? Have a person done there. All you do is one person there, instruct the patient to just clean it up, and then it just gives us shots. All kinds of technology thing. You know, you see here smart glasses, bracelets, fingers, and smart rings. all kinds of things are there already available. And that communicates with the physician, communicates with the physician's office so that they can recognize that the blood pressure is high or heart rate is very high or some things like that. Oh, this is fantastic. The patients with Parkinson's disease, they have a tendency to lose balance and they fall down. And they are incorporating special shoes in which there are multiple chips. And whenever they turn this way, it recognizes the pressure is the side, immediately sends a message to the patient, hey, go this way, don't go to, so that it can prevent the stroke. And also it tells the patient to have wider steps so that you won't fall down. Headband to recognize seizures. When the patient gets a seizure is not the problem. They don't know when they're going to get it. They fall down, they hit their head in the floor, hard floor, or hit it on the table, corner of the table, and they get head injury. That is one of the major problems. But this guy tells the patient 2 minutes ahead of time, hey, you're going to have a seizure. Find a carpeted area and lie down so that he will, even if the seizure occurs, he doesn't get injured. Wristband. It also not only warns a patient about what seizure is coming, it sends an ambulance to the patient's home. It sends an ambulance to the patient's home. Oh, this is phenomenal. Patients with a stroke, you know what they, right? They won't be able to walk. It's called cerebrum, right? Cerebrum, there are some centers who makes the legs walk. And this patient has not walked forever, for many years. They inserted a chip in the cerebral area from outside, from iPhone. They stimulate the brain and do it in appropriate algorithm, and he's able to get up and walk. Can you believe that? It's happening today. It is future is unbelievable. And the second one, this patient, there's an area called Broca's area in the brain, on the left side of the brain. And if that one the stroke happens there, patient cannot talk. They can understand what you're saying, but they cannot talk back. And again, the same chip, similar chip, they put it there with AI algorithm. When somebody talks to them, they'll understand. But normally they cannot express. They think the answer. For example, do you want coffee? Somebody is asking. Oh, yes, I would love to have that with cream and 2 spoons of sugar. And it types it. It types it in the printer. The message is going to the printer and printer types it. Isn't it wonderful? Isn't it? Hey, it's a fiction. Fiction has come true. Oh my God. Same thing. One of the patients with amputated hand, and there is a prosthesis is there. And the patient wants to grab a glass of water. Before, it was not possible. With AI, they're able to send the message from the brain to the amputated hand. It just goes, grabs the water, and drinks. If you don't believe, you watch a 60 minutes. Aura Ring, many of you are probably using that. It checks your heart rate, blood pressure, sleep pattern, oxygen saturation, everything. And during COVID time, the robot will go and sterilize everywhere. Because COVID time, nobody wanted to get into the rooms, exam rooms and all that. So it goes and cleans up everywhere. Sorry guys, I'm rushing the slides. If you really want, we have a conference, healthcare conference in July 12th. Okay, sign up. We are going to be running out of the space just like this. We'll try to find another bigger space, and we are going to have that extensively. We are going to have a lot of fantastic talks. AI in cardiology. Previously, if you do an angiogram, if there is 80% blockage, immediately we do a stent and bypass and all kinds of crap. Now, there is a hot flow system available, AI system is available. That blockage of 80% blockage is anatomy. Who cares about the anatomy? We talk about physiology. Is the blood, enough blood is going past that blockage and going there? That is the beauty. That is we able to estimate. And this one, look at this here. If it is 0.9 and this is a stenotic area, if it is below that, if it is 0.8 on above, then the patient does not need a surgery. Exactly that happened. One of my relative had this test, 80% blockage. Surgeons, I mean cardiologists always run and do the angioplasty, but we did this test. The patient had fantastic blood flow. So we skipped that. So why is it not? It's been allowed. Thousands of articles are there. You know why cardiologists, is any cardiologist here? I won't tell anything. No. If the cardiologists never propagate this, you know why? They don't want to shoot themselves in the foot. That's the reason why. There's no money in telling them not to have angioplasty. Oh, this is unbelievable. You know, stethoscope, you just listen to the heart, right? Unfortunately, sometimes men are obese and some women have large breasts, so we won't be able to listen to the heart clearly. Now we can increase the volume of the stethoscope. We will be able to hear the voice. And then we can also, still if we're not clear, murmurs we won't be able to hear. So we can do sonograms. Sonograms are in the form of graph, just like EKG. So in between the heartbeat, there will be other graph, sonogram will graph, and we will be able to see whether there is a patient has valvular stenosis or valvular leak, so we can appropriately intervene. And in addition to that, it also does EKG. Can you believe that? Stethoscope is doing sonogram, and you know, it's unbelievable. This is the same company is making another one, which is also a stethoscope, but it knows whether the patient is going to have heart failure. Never in the history of medicine, never in the history of medicine we have encountered that. EKG, from the EKG, we are trying to find out what's heart failure is one of the toughest to treat. The largest amount of deaths are occurring because of heart failure, hospital admissions and everything. It detects it earlier, so that we can start the medicine earlier, preemptively prevent the heart failure. This is a EKG thing. So it is available. Anybody can buy that. There is a condition called atrial fibrillation. Atrial fibrillation is rapid heartbeat and then suddenly it becomes normal. This is the commonest cause of stroke. Okay, commonest cause of stroke. Initially, you might feel dizzy, you might feel faint. Please go to the doctor and have a Holter monitor, cardiac evaluation. That will pick it up, atrial fibrillation, because that's a common. If you guys don't want stroke, then you do that. You don't mind stroke, that's okay. You can leave that. Okay, the same thing. You can see the EKG tracings. This is, sometime we won't be able to look at Holter monitor 1 day or 1 week length of time. You won't be able to pick up the irregularities. So this can be inserted into the chest wall like this. So that sends a message that atrial fibrillation is happening to the patient's phone, to the cloud. From the cloud, the cardiologist will also get that. AI in radiology. Radiology leads in AI. Reduced artifacts, reduced dosage of radiation, and enables fast scans. This is a real story. When the patient is going to the hospital emergency room with a chest pain, whenever the chest pain is occurring, we need to think about pulmonary embolism. Pulmonary embolism is a dangerous condition and it can cause death. So they did a CT scan and radiologists read it as no pulmonary embolism. So let's admit the patient to the regular cardiology floor, just to check the cardiac. But the AI say, hey, don't make mistake. The patient has fractured rib. Can you believe that? AI is telling the radiologist, hey, it's a fractured rib. So instead of admitting the patient in cardiology unit, the patient was sent home. Another doctor, uh, the radiologist, during COVID time, the patient is having shortness of breath. The patient is having, the radiologist diagnosed it as COVID pneumonia. So the patient was ready to go to the infectious disease floor. But the AI says, no, don't send that. The patient has pulmonary embolism. So the patient was sent to ICU instead. Isn't it fantastic? It's going to change the entire medicine. Multiple sclerosis, very difficult to diagnose. It shows beautiful spots where the multiple sclerosis lesions are. Treatment wise, multiple sclerosis, they do an MRI, they see whether it is there or not to decide about the treatment. And the radiologist says that these patients, about 1,000 patients, these patients, 76% of the patients are stable, you don't need any treatment. But the AI says that no, 75% it is not under control, the patients need treatment. Medicine is changing forever. Alzheimer's disease, very difficult to pick up. Look at the difference. Regular MRI, regular CT scan, and with the AI. This is fabulous. This is Viz. This product, its name is called Viz. So what it does is it works in your iPhone. It's a practical thing, right? You don't have to go to the hospital to look at the computer, right? So when the patient comes to the hospital, the patient is complaining of abdominal pain or chest pain, CT scan is done. Siemens and other companies do that software. So it immediately, even before the radiologist sees that, radiologist is busy seeing patients. So radiologist, it says, oh, this patient has dissecting aneurysm. The patient immediately needs care. It sends a message to the ER doctor. It sends the image and the message to the surgeon, vascular surgeon. It sends a message to the ICU. It sends a message to the primary care doctor's office. Everything is done simultaneously. So everybody will be prepared. ICU will clear up the room, and it's marvelous future is ahead, guys. Okay, same way, pulmonary embolism, similar thing. ICU is indicated, intensive care unit is indicated, pulmonology is indicated. Similar thing, CT scan of the head, large vessel occlusion, intracranial hemorrhage. You see the hemorrhage there. This is a subdural hemorrhage and visceral aneurysm. So all these things can be done, and all the specialists are instantly informed. Prostate, enlarged prostate can be a benign enlarged prostate, or it can be cancer. This immediately detects. We don't know unless we do the biopsy. It tells us, hey, you don't need a biopsy. This guy has cancer. And also, it also tells us where the tumor is, where to do the biopsy. AI detects, mammogram detects with AI 2 years ahead of the cancer diagnosis, 2 years. So all these women's life can be saved. Oh my God, it's unreal. Not only that, we can have the MRI and ultrasound and precisely know exactly where the tumor is, and we can do a needle biopsy right away. Lung cancer, easily, one or 6 months ahead of time, we can recognize that. Oh, this is fantastic. A fracture, the patient is going to the emergency room with fractures, okay? So they are not able to detect what is the fracture from. The patient did not fall down. So MRI makes all the ribs straight. You know, it's very difficult to look at, right? All the organs are there, very difficult to identify. Straight. So now we know this fracture is due to metastatic. Cancer has spread into the ribs. 1, 2, 3, 4, 5, 6, multiple areas. Cancer has spread into all these ribs. That's the reason why 3D MRIs. You will be able to see all the organs, fantastic, inside the organs, all of them. If a fracture is happening, if the fracture is happening here, we want to make sure that the liver is also not injured, right? So we'll have a technology into just, we can just go step by layer by layer by layer, see whether there is liver is involved. There is a cancer here. We want to see where it has spread. Now there are 3D MRIs. You'll be able to see where the cancer is, whether it has affected the lymph nodes, the arteries, veins, all the things, thyroid and everything. Amyloid disease, yeah, the same thing we talked about it. Oh, regenerative medicine, it's fantastic. Okay, the scar tissue is now we are able to produce organs, different organs. Heart muscle, we are able to produce in the lab. Liver, you are able to produce in the lab. So what are the benefits? If the patient has heart attack, there is a scarring of the artery, or the wall of the artery. So now it will lead to congestive heart failure. 1/3 of the patients with heart attack will develop congestive heart failure in 1 year. 50% of all the patients with heart attack will develop heart failure in 5 years. Heart failure is cause of the death, I mentioned to you. Now we are able to resect the scar tissue and put that cardiac tissue there, and it'll start functioning. The heart failure is gone. Organoids, we are able to produce. Before we used to do experiments on people, human live, right? Okay, to see whether there is liver abnormality or something like that. Now we are able to produce organoids, liver tissue, make it into a bulk of liver tissue, and we can do transplantation. That we are heading there towards that. Kidney tissue, we can create it, because so many people are not dying in accidents. We always need a kidney transplant donors. So we can produce kidney tissue in the lab. And then cheaper colonoscopies, because AI is doing the colonoscopy, sedation. It knows exactly how many times they breathe and how much the oxygen level. It adjusts the colonoscopy thing. AI in ophthalmology, it is unreal. With DeepMind AI, just looking at the eye, retina, 50 different diseases can be identified. I'm repeating it. Looking at the retina, 50 different diseases can be diagnosed with AI. Contact lenses, guess what? Contact lens, it can detect the glucose and it can help glaucoma. Scientific fiction is coming into true. Retina implant. The guy who has been blind, they implanted a chip into the retina. My God, he is ecstatic. My God, for the first time I'm seeing colorful things. Oh my God, in my life I have not seen. Contraceptive pill. You can implant a contraceptive pill into the belly, and with your iPhone you can operate. Okay, when you want to have pregnancy, when you don't want to have a pregnancy, you control. Okay, you don't need to pop up all the contraceptive pills. Isn't it amazing? AI in dermatology. All you do is look at the lesion, it tells you exactly what is the diagnosis. Okay, if it is a simple mole, you don't have to go to the doctor and pay $300 of consultation. Okay, it knows only abnormal things, you go and take a biopsy. From home they can do. I recently invested in a company, because it's the investors group. I invested in a company called RomTech. Okay, they do physical therapy at home. So one physical therapist can do only 4 patients a day. Now with the AI technology, they put the machine and everything, and telephone, cell phone, everything. He sits in the clinic and sees about 15, 20 monitors. He can monitor everybody. 1 hour, 10 different things can be accomplished. A lot of times we are not able to, in the bronchoscopy, we cannot able to go into the tumor, okay, because they're all small arteries are there. I mean, so small bronchioles are there. Now with AI, thinner bronchoscopes are available, and in the tip there is ultrasound. It sends ultrasound and finds where the tumor is. it navigates into the small bronchioles to reach the tumor to take a biopsy. Pulmonologists cannot do that all the way down. Sepsis, sepsis. Um, yeah, the previous speaker told how important it is to diagnose sepsis. Emergency room patient, there are hundreds and hundreds of lab results and exam findings and everything. Immediately it tells the doctor, hey, watch out, the patient is going for sepsis. Okay, 3 days ahead of time. 3 days ahead of time. So immediately the patient can be admitted in ICU, appropriate things can be taken care of, and the patients can be alive. Okay, this is one of the things. 24 hours prior to the shock, another software, and 2/3 of the patients prior to organ dysfunction it can detect, and 60% of the patients increased detection performance. Nuance, I know that plays. Look at this, robotic surgeries, medical marvel, medical marvel. Okay, so the robotics are performing thing, and then surgeons are just looking at it and getting paid for that. Can you believe that? Drug discovery, it is unreal amount of. This morning I sat down and eliminated 30 slides because I want to face them. They'll be standing with the whiplash. All right. Drug discovery. Drug discovery, it is exploding. Accelerating identification of the potential drug candidates, predicting the efficiency, enhancing the FDA approval, and drug testing. Drug testings are done in organoids. Do you remember I talked to you? You don't have to give it to the patients and they complain about bitching and moaning. You don't have to do that. You can do it in organoids, kidney cells and liver, and see whether there is any side effects there or not. Okay, so we are avoiding unhappy patients. $30 billion are spent for drug discovery on each one of them. Okay, now you know why the medicines are so expensive. Okay, when I was practicing, majority of the patients told me that I would rather die of the disease rather than starvation. Okay, I cannot afford the medicine, and this is the reason why. Guess what? It's going to change. Google has detected 200 million proteins. 200 million proteins with which we can do the research, and drug discovery is going to be much faster. Robot will see you now. Palm 2, as we are seeing the patients, it tells about the differential diagnosis, treatment plan, drug-to-drug interaction I mentioned to you, progress notes are documented. Now that I have a little bit more time, I want to tell you a real story. Okay, so I had to have a nasal surgery, sinus surgery. So I want to have a clearance. I'm a retired doctor. 2 years ago I retired, so I cannot write a note myself. So I called one of the guys. There are about 5 of my friends said, oh, I'll see you. But I said, no, I don't care. I want to see a person with artificial intelligence because I'm just a doctor, but I'm fascinated with technology. So I told them, find me who is a doctor. So one of the guys said, I'm a. So I went there, and then he took the phone and then turned it on and asked me, hey, you recently went to India. How was your trip? I said, it was fantastic. We had a good time. What are the places you went? I went to Kashmir and all that. How is your wife? I thought saw her postings. She went to Singapore. I said, but you turned it on. It's a medical thing, software. It is recording everything what we are talking. He is telling me, no. It knows that I'm socializing. It eliminates everything. And then he asked me, what are the medicines you're taking? I told about 4 medicines. Okay, hypertension, So I know I didn't say hypertension. I told the medicine for hypertension, medicine for cholesterol, medicine multiple, herbal medicine. That's all he did. I did. Anyway, to make the story short, by the time I could take an EKG and come back, he brought his computer, and it said everything. This age person, I don't want to tell my age. This person is coming for clearance and this and that. All the daily, we never talked about it. And then when he listened to my lungs and heart, he says verbally, heart is good, lungs are clear, everything is written. And diagnosis, he never said hypertension, cholesterol, and all that. From my medicines, it interpreted hypertension, cholesterol, and in the progress notes, it says, his blood pressure is good. We'll advise him to continue the same dosage and all those things. It's fantastic. And then patient education materials, right away it gives. Relieves a burden, workload burden immensely. Exciting future of exploding technology in healthcare is yet to unravel. We are rolling up our sleeves to answer all your questions. Come on, shoot. After that.
Let's give Venu a standing ovation. Venu, we need a conference just for you.
Venu Prabaker is the chairperson for our healthcare. Yeah, I'm a wireless guy. Healthcare conference on July 12th.
Guys, sign up. We are going to have top-notch speakers from healthcare. I will enroll them personally and then beg them, make them come here. Okay? Okay.